Isang maganda at malusog na hapon po sa ating mga regular Kapihan viewers sa Facebook at YouTube pages, gayon din sa ating mga media partners. Ako po si Nikki Nasasario, isang huwada mula sa Kagawaran ng Kalusugan, and welcome to today's Kapihan with Media. Bago po natin tuluyang umpisahan ang ating talakayan para sa araw na ito, narito lamang po muli ang ating mga house rules. To ensure the smooth flow of this session, everyone is encouraged to, number 1, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Number 2, pay attention to the discussion of our health experts and or resource persons. Number 3, keep your microphones muted while speakers are discussing and presenting. And number 4, should you have questions, participants shall signify and send them in the Zoom's chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion. Submitted questions will be addressed first by our experts, followed by Zoom chat box questions. Every participant is advised to reserve questions. And again po, only questions related to the topic discussed will be entertained. We encourage everyone to join the meeting until the last part of our session. So tomorrow, August 19, we will observe the National Tuberculosis Day. And to give us an overview of the national data and programs for TB, we have with us today Ms. Marlene Galvan, Nurse 4 and TB Focal from the Disease Prevention and Control Bureau ng Department of Health. Good afternoon, Ms. Marlene.
Good afternoon, Nikki. Good afternoon, everyone.
Ayan. So good afternoon, Ms. Marlene. We will proceed po sa pag-share ng kanilang slides. And then you may start po right after.
Thank you so much. So isang mapagpalang araw sa ating lahat. So as Nikki mentioned, August was declared as the National Lung Month in the country through the Presidential Proclamation number 1761, which was signed by the former President Ferdinand Marcos on July 24, 1970. Next slide, please. So in 2021, the Philippines is considered as one of the 8 countries that account for 2/3 of the estimated global TB cases. So every day, around 164 Filipinos die from TB, which is a completely curable disease. The Philippines is also the 4th largest contributor of TB incident cases, of 7% of the global total. So compared to 2019, in 2021, there's an increase in the number of infected TB cases from 650. So there's a really huge difference from that of the 2019, which is 550. Next slide, please. So substantial reduction in TB case notification in the Philippines was also contributed to the pandemic we had during 2019. So one of the reasons I think was due to the lockdown during that time. Patient cannot, hindi talaga sila makapunta sa mga health facilities due to fear, di ba, na magkakuha sila ng COVID. And yung restrictions because of the lockdowns, and not everyone can go out or can access to different kinds of services. Next slide, please. So as we can see here, as of 2022, only NCR was able to reach its target in terms of the treatment enrollment. And it was followed by Regions 4A, 3, and Region 6. However, if you can see in this slide, makikita po natin na those areas in the far-flung are still lagging behind, such as farm, car. Next slide, please. It is also contributed that the poor bear the greatest burden of TB and health inequalities. So other factors that contribute to TB infection could be some of the risk factors such as undernourishment, overcrowded population or areas, poor ventilation environment, and some vices such as alcohol use, smoking, and that contributes also other disease conditions such as HIV infection, and diabetes. Next slide, please. So strategies to reduce the TB burden must address in addressing also some social determinants of TB. So such as economic factors. So 50% can be traced back dun sa people working or yung may regular income sila, of course, because syempre if you have regular income, you can buy the nutrition, the food, and all the needs they'll be needing. Okay? And then the physical environment, as mentioned earlier dun sa previous slide natin, yung mga crowded area, poor ang ventilation, and also of course, it also plays a big part yung health behaviors natin. So mentioned in the previous slide yung mga vices niyan. So kung ninigarilyo ka, hindi ka nag-exercise, and then mahilig ka uminom ng alcohol, and also yung sexual activity. It also contributes. Then in order to address that also, of course, yung ating access to healthcare. Next slide, please. So promoting healthy setting is one of the strategies in order to prevent TB infection. So there was a playbook that was developed by the Department of Health. This being cascaded at different area of level of cares. So meron po yan. So it can be accessed also through our DOH website. Next slide, please. In September of 2022, the Department of Health issued the health sector strategy from 2023 to 2028. So the strategic thrust of this strategy is aims to make Filipinos healthier through the provision of better and more equitable health outcomes and responsive health system and improve financial risk protection. So there are three goals, which is the first is to enable Filipinos to be healthy. Second is to protect Filipinos from health risks. And the third is care for Filipinos and health and wellness. Next slide, please. So integrating TB.package package to consulta package to cover more patients is also one of the strategy. From 925 TB dots accredited facilities, this integration will increase to 1,756 PhilHealth accredited consulta package. So to date, yun po yung ating census. But by 2040, we are looking that around 3,858 primary healthcare will already be accredited as DOH at TB dots facilities. Next slide, please. So doubling our primary care facilities by 2040 will definitely provide impact to improve navigation of TB patients. Kasi by 2020, ina-expect natin na yung hospital bed will have 2.7 for every 1,000 population, vice versa with the other healthcare facility. Next slide, please. So improving TB detection through during COVID-19, during the pandemic time, we also use the gene expert. So since now there's already a decreasing number of COVID cases, so we can utilize those gene experts in existing laboratories already in order to detect more TB cases. Next slide, please. Next slide, ma'am. Thank you. So just to give you a short view, no? So this is the strategy we are looking into. Some are already being implemented. So we cover from prevention because that's the most important strategy. Prevention to TB exposure or infection. Then we will do the screening and diagnostic testing, diagnosis, as well as treatment and care. So I've mentioned during my first presentation that TB is curable. Okay, next slide, please. So just to summarize, these are the TB strategies for current and future. So we have for prevention, we have for screening, detection, as well as treatment and care. Um, I, I think that's all. My last slide I just want to emphasize that in order to address or stop TB, we should work together as a whole. Hindi lang DOH, but all the community. Thank you.
Ayan. So maraming salamat Miss Arlene. Bilang isa sa marching orders ng Pangulo na wakasan ng TB, talaga makikita po natin ang mga programa ng kagawaran para dito. So makakasama po natin muli si Miss Marlene mamaya para sagutin ang ating mga katanungan. At upang talakayin naman sa atin ang DOH campaigns and initiatives for individuals with TB, joining us is Dr. John Errol Yabut, Medical Officer 3 and Campaign Manager for Behavior Change and Social Mobilization Division at Focal for Campaigns on Substance Use Prevention, Non-Communicable Diseases and Tuberculosis ng Health Promotion Bureau ng Department of Health. Ang haba nun, Doc Errol. Good afternoon po.
Good afternoon, Miss Nikki. Thank you. Am I coming in clear po?
Yes po. Doc Errol, we will share your slides na po and then right after you can begin your discussion po.
Thank you po. Hi, good afternoon, everyone. So I'm coming here from the Health Promotion Bureau po, no? At the DOH, we envision a healthy Pilipinas where individuals are health literate and health seeking, settings are health enabling, and our governance is health supporting. So Ma'am Marlene's presentation earlier touched on these na rin po. And I'm very happy po to join you to discuss National TB Day. So next slide, please. The following slides po are a sample as well as a backgrounder then. Just to add po no, to the background given already by Ma'am Marlene. This is one of the health education decks that our Bureau provides to our regions, down to our implementers po at the ground that they can use for health education on TB. So next slide, please. So this was already mentioned that August 19, that's why it's National TB Day. It's because it's the birth anniversary of President Manuel L. Quezon who died of TB. And we celebrate this every year, alinsunod po sa Proclamation number 840, 1996. Next slide, please. And as of the latest available PSA leading causes, in our next slide, please. Leading causes of mortality for the year 2022, period of January to November. Sorry, am I still online?
Yes po, Doc.
Ayan. Next slide po, please. Sorry. Ayan. So from the period of January to November, TB was noted as the 10th leading cause of death in the Philippines. No? So yung number of cases recorded in FHSIS 2022, TB in all forms is 119,500. It also figures mortality, parte pa rin po ang TB sa ating latest na mga numbers. So in the next slide po, there. So ano nga ba ang tuberculosis? I guess this is also Googleable. Just to breeze through lang po no, na it's an infectious disease caused by a bacterium, Mycobacterium tuberculosis. And it primarily affects our lungs. So it's called pulmonary tuberculosis, but it can also affect other parts of the body or extrapulmonary tuberculosis. Maaari nito maapektuhan pati po ang ating buto, ang ating utak. Outside our lungs. And usually this happens po when our TB, respiratory or pulmonary TB remains untreated. That's why we highlight early detection and treatment during the period at which we can still control complications. No? So ang microbial TB ay pwedeng umatake sa anumang bahagi ng katawan, pati po sa ating spine, no? Vulnerable, especially po among our vulnerable populations. Makikita rin po natin to among children who have TB of the spine and TB of the brain, TB meningitis. Next slide, please. So paano nga ba ito kumakalat? And this is where most of our messaging po is hinged on, so that we can create positive behavior change para maiwasan po ang pagkalat ng TB. So ang TB ay nasa hangin mula sa tao papunta sa ibang tao. So nakakalat po ito sa taong may TB papunta sa ibang tao. Maaari po it remains suspended in air for hours, no? For ng ilang oras. It can be pwede siyang malanghap ng mga ibang tao kapag po ang taong may TB ay umubo, nagsasalita o kumakanta. Maaari din pong malanghap ito ng mga maaring malanghap ito ng mga tao na malapit or nasa isang enclosed area na may poor ventilation. Okay, next slide po. And given po na alam natin sa Pilipinas, we are one of the countries where TB is very prevalent pa rin. No? It's very important for us to know na sino po ba ang may mas mataas na panganib or those who have those who have risk factors for TB. Ang pinakapangunahin po natin na tinitignan are those who are immunocompromised or may mahinang immune system. So included po here are infants, are children, those who are the people living with HIV, those who have diabetes, cancers, and other those who have HIV cancer and diabetes. So these are our most common immunocompromised states. Next slide, please. So apart from that, so we know po na TB usually narinig po natin meron tong cardinal signs and symptoms including yung mga pag-ubo ng 2 linggo o higit pa, unexplainable fever, unexplainable weight loss, night sweat, at saka po night sweat at saka unexplainable chest pain, no, na hindi ma-explain ng ibang cause. So apart from those po, no, so symptomatic TB, sorry, am I still audible? Nag-change lang ata yung mic. Hello. Yes. So tuberculosis can be parang incubating or within our body pero hindi nag-manifest ng symptoms. Tinatawag natin itong latent TB infection. So pero kapag ganito po yung nangyari, maaari pa rin tayo magkaroon ng sakit na TB sa hinaharap of patients who are undergoing treatment ng TB ay mas screen din for latent TB infection kasi po may management din po para sa mga people who have been identified na may latent TB infection para po ma-prevent na magkaroon sila ng TB disease later on. So next slide please. So ito po na unahan na natin kanina, no? Paulit-ulit po natin itong gustong i-emphasize na ito po yung mga sintomas ng pulmonary TB para po kung na-observe po natin ito sa atin or sa mga mahal natin sa buhay, pwede po natin silang mapayuhan na magpa-check up or magpatingin sa doktor para ma-screen at makapag-umpisa agad ng treatment. So inandyan po yung 2 weeks or more na ubo, lagnat, pagpapawis sa gabi or night sweat, pananakit ng dibdib, not referable to other explanations, pagbaba ng timbang, pagkawala ng gana sa pagkain, pag-ubo na may bahid ng dugo, at mabilis mapagod. Yun nga lang po, no, alam din natin na may percentage din po ng mga TB patients natin already have TB disease, pero wala ding symptoms. Kaya po ang ating call to action ngayon in our guidelines din po na importante na meron tayong annual chest x-ray. So in our annual chest x-ray, it's a good screening tool po for us to know na tayo po ay clear pa rin of TB disease. And then in our next slide po, so ito po yung mga usual na screening modalities natin for TB na makikita po natin sa ating mga primary care provider, health center, mga DOH facilities po. So for screening, we have the chest x-ray. And then later for the confirmatory or bacteriologic confirmation, we do have the DSSM and gene expert modalities po for the confirmation. And then the next slide po. So given po all that, what we emphasize po in our messaging din is prevention. No? Other than yung na-mention na po natin kanina, it's important for us to follow the 7 healthy habits which we promote at the Health Promotion Bureau. So that includes eating right and moving more, so pag-exercise and pagkain ng masustansyang pagkain. Kasama na rin po dyan yung adequate hydration. And then yung other din po natin na healthy habits na mention na earlier ni Ma'am Marlene include avoiding smoke. So smoking and vaping cessation din po, we avoid that. And also being clean, be clean and live sustainably. So by observing proper hygiene, we are able to control infections better, preventing them from spreading. And syempre, nandun pa rin po yung ating agarang pagpapakonsulta sa doktor kung tayo po ay alam natin na may sintomas na or alam po natin na tayo ay at risk, katulad po ng mga na-mention natin na characteristics earlier. And kapag tayo po ay nabigyan ng payo, nabigyan ng advice kung ano po ang dapat gawin, dapat po natin itong sundan. Ang gamutan po ng TB ay at minimum nasa 6 months. So kailangan po ng close follow-up and community support, family support, para po ito ay ma-adhere ng ating mga naggagamot for TB. At importante po na masunod ito para po una makapaggamot na maaga, gumaling na maaga, matapos na agad ang gamutan. At pangalawa, para po ma-prevent po natin yung further spread ng disease and ma-prevent din natin yung pagkakaroon ng drug-resistant or DR tuberculosis. So next po, so yun nga po, paano tayo gagaling mula sa TB, nandun po ang ating directives or treatment short course or TB dot, which is 6 hanggang 10 buwang gamutan. At kailangan po itong matapos, maaaring lumakas at maging aktibo ang TB bacteria or resistant kapag hindi ito natapos or abruptly po itong hininto. At naapektuhan na nito ang buong komunidad dahil po ang DRTB ay may ibang treatment modality, no? Siya po ay tatagal palalo at mas delikado po for the whole community. Next po. So siguro one more question is kung nakakahawa po ang TB, kailangan po bang mag-isolate we touched on this earlier na it's a droplet transmission na nahahawa from a person na umuubo, bumabati ng salita, lalo na kapag hindi okay ang ventilation ng room. Pero para po maprotektahan ang ating mga mahal sa buhay, ang pinaka-importante po natin na dapat gawin is simulan po ang agad na pagpapagamot. Ang tao po na 2 linggo nang nagagamot at nagkaroon ng follow-up sputum smear na negative ay hindi na nakakahawa, ngunit kailangan pa rin ituloy-tuloy ang gamutan. So yun po yung gusto natin ma-highlight dahil gusto rin natin na matanggal ang stigma ng TB. Ang tao po na nagagamot for TB kapag meron ng negative sputum smear follow-up ay hindi na po nakahawa at maaari na po bumalik sa kanyang regular activities, so sa school, sa work, at home, etc. Next slide po. So siguro isa ring tanong is kung may TB ako, pwede rin po ba akong magkaroon ng COVID? Yes. So kaya kailangan magdoble ingat para po doble ingat, lalo na po yung mga tao din na merong comorbidities or higher risk like our senior citizens, those who have hypertension and diabetes. Syempre kasama na rin po dito ang ating message na magpabakuna laban sa COVID. So yung mga nagpapa-booster or mga hindi pa nakakapagpa-primary series, kasama rin po ito sa campaigns pa rin na tuloy-tuloy na ni-roll out natin sa HPV. Next po, for LTBI na mention natin earlier, yung latent TB or yung mga walang sintomas pa na tuberculosis. In the next slide po. Meron po tayong tinatawag na TB preventive treatment para po malabanan ang pagkakaroon ng TB disease. So ito din po ay makukonsulta o masasangguni natin sa ating pinakamalapit na primary care provider. Okay. And in the last slide for the health education deck, yun po, maaari po natin itong makapagtanong pa sa ating mga PCP, sa ating mga health centers. Okay po. In the next slide po, this figure was also showed by Ma'am Marlene earlier, no? So what we talked about so far are what TB is, what are the risk factors, what are the signs and symptoms, ano po ang gagawin para gumaling sa TB. So kung papansin po natin din, no, ang dami, much of what is being discussed is the treatment kasi nga po napaka comprehensive and detailed po ng ating manual of procedures para po sa ating patients who are being screened and treated for TB. At master po ang ating mga PCPs nito para po mabigay yung tamang service to our community. However, we also know po na that part, that whole very detailed and comprehensive part, figures at around 20% of the total outcome ng ating health outcome. That includes po lung health and tuberculosis. And 80% or more, parang majority of the health outcomes actually depends po on our communities or the multi-sectoral efforts. These are, so while we are hard at work in making sure na these important services po are accessible to all Filipinos. We also emphasize that about 80% of these outcomes is determined by factors outside the healthcare system. And our work at Health Promotion focuses on making sure that the places where we work, our communities, places where we study and live and play, these are our schools, communities, workplaces, are conducive to healthy habits, the 7 healthy habits, as well as health-seeking behavior. So for tuberculosis, this includes for our information campaigns on how to prevent TB through healthy habits, how to recognize the risk factors and symptoms that can prompt early screening, and how to navigate the health system by first interfacing with our primary care providers. So in the next slide, I'll go na po to just highlight our campaign activities and materials for tuberculosis. So sige po, next slide. Just briefly, we would like to share just the behind the scene vision and objectives of our campaign. So we want all Filipinos to be actively taking the necessary steps to keep them safe from TB, from tuberculosis, while patients already diagnosed are able to seek timely treatment from health facilities and prevent further spread and possible complication. Next slide, please. But we recognize constraints for to this vision, and that includes individuals and families avoiding screening and treatment due to perceived costs nito, no? Both opportunity and real costs. So there are also perceived personal costs, which include stigma and also the real cost of months-long tuberculosis treatment regimen, which discourages already symptomatic individuals and also those at risk to get screened. So our objectives to address this and next vision and the constraint next is to increase the public's awareness on the risk factors, signs and symptoms, the preventive measures, and the importance of early diagnosis and proper treatment to avoid drug-resistant TB and other complications. Next slide, please. So in general, we have the following products or activities that we develop for the public. That includes our national digital communication campaign, which we roll out both online and also through traditional media. We also hold several education activities for the lay for like such as a forum, webinar, etc. And we also have below the line activities, which are the localized ground communication campaign, including launches, fun runs, social mobilizations, etc. So just to show yung ibang upcoming natin, next slide please. So tomorrow it's National TB Day. August 19, we'll be holding a National TB Day webinar. This is in partnership with the Philippine College of Chest Physicians. So that's still upcoming. That's tomorrow at 2 p.m. You can watch out for this at the Healthy Filipinas Facebook page. Last Monday, we had the Lung Month Consultayo webinar. So it's for the National Lung Month naman po, no? August, but the topic is still on TB and HIV. This one naman po is in partnership with the Lung Center of the Philippines. So apart from the webinar series, we also have next slide, please. Our social media campaign, which we roll out throughout the whole month, both for Lung Month and tuberculosis on our social media pages at Healthy Filipinas. Next slide, please. We also have community activation. So last August 12, we have the Run for Healthy Lungs Fun Run at De La Salle University, Dasmariñas, in partnership with Center for Health Development for a Calabarzon and the local government unit or city government of Dasmariñas. On August 22 on Tuesday, in partnership naman po again with the Lung Center of the Philippines, we'll be holding belated National TB Day celebration. So TB at HIV Tuldukan Tara Konsul tayo at the LCP. And lastly, on August 31st, we have service delivery event and health promotion event with USAID TB Innovation and Health System Strengthening Project at the Masha Sports Complex in Dumaguete. So at the last slide for more information for our 7 Healthy Habits, our Consultayo campaign, and in particular for tuberculosis. You can go po to these products, healthypilipinas.ph and Healthy Pilipinas Facebook page. And Healthy Lungs, this is a project po with TB Innovations and Health System Strengthening, FHI 360, co-developed with them. This information source po both on Facebook and on their website is focused po on lung health and tuberculosis. So that's my last slide po. Thank you for your time.
Ayan. So maraming salamat po, Doc Errol. Tinalakay sa atin ni Doc Errol ang mga dapat nating gawin upang maiwasan ang pagkakaroon ng TB. Gayun din kung sakaling tayo ay magkakaroon nito. So makikita po natin na available po ang ating healthcare services sa ating mga primary care provider. Gayun ding nabigyang highlight ang mga campaign efforts ng kagawaran upang sapat tayong ma-educate patungkol sa TB. So di na rin po natin patatagalin pa ang atin pong sasagutin ang mga katanungan natin para sa hapong ito. At muli po, makakasama natin si Miss Marlene and si Doc Errol para sa ating questions for today. So para po sa ating unang question addressed to Miss Marlene, how many individuals have received free tuberculosis treatment from the DOH po?
Actually, Vicky, for this year, around 251,854 patients has already been treated or provided treatment for TB. So we got this from the integrated TB information system that the DOH is maintaining. Thank you.
Ayan. So maraming salamat for that, Miss Marlene. And para naman po sa ating next question, para naman po kay Doc Errol, for our tuberculosis campaigns, did we identify pilot sites for implementation? Can we share initial results from these sites po?
Thank you for that question po. So for our campaigns, including TB, we implement these campaigns nationwide, and regions implement their own versions of the campaign. So this time around, yun na-mention po natin earlier na activities that was with Region 4A, and other regions are also celebrating this. We are piloting pa po for the results, but I hope we can share insights po on what the pilot has been soon.
Ayan. So maraming salamat for that, Doc Errol. And probably we will wait for the update ng results para sa ating mga pilot sites. So para naman po sa ating next question for Miss Marlene naman po, meron po bang specific programs for tuberculosis para sa ating mga kabataan?
Actually, as I've mentioned, holistic yung approach natin ngayon, So meron tayong ginagawang paggagamot, or we have programs from all stages of life. So from bata hanggang matanda, meron tayong mga serbisyo na ibinibigay sa mga pasyente na nada-diagnosed with TB.
Ayan. So maraming salamat for that, Miss Marlene. For our next question po, again for Miss Marlene and maybe Doc Errol would like to add po, is it true that TB is genetically passed on from parents to children? And if ever po ba na magkakaroon ng TB ang isang tao, maaari po ba siyang magkaroon ulit ng TB right after recovery? Miss Marlene and then Doc Errol, if you would like to add po.
Okay. I think some of the response to that was presented already by Doc Error, but we just like to highlight or emphasize that TB is a droplet or airborne infection or bacteria, So hindi siya namamana. So it cannot be transmitted genetically. So may mga factors na di-discuss kanina. So kung ikaw ay malnourished, ikaw ay mahina ang iyong immune system, plus the fact na may mga vices ka pa such as smoking, vaping, drinking of alcohol, yung living condition mo So those are the factors that contribute kung paano ka magkakaroon ng TB or bakit ka nagkakasakit ng TB.
Thank
Ayan,
you,
ayan. Sige
Ma'am
po, Doc
Marley.
Aaron.
Yes, I think po if you would look up studies, no, there might be different, ang tawag dito, different evidence or parang levels of evidence that we would find. However, we would still go back po sa lahat po na sinabi ni Ma'am Marlene. So those are at the research level, but right now po what we want to emphasize, lalo na po dito sa ating bansa, kung saan very prevalent pa rin siya, na ano po ba yung pinaka-common na way na natatransmit siya is still through the usual infectious means. And we have ways po no, to prevent that. And that's what we want to still emphasize in our messaging. So we still go back po to what we want to say both in preventive to health behaviors, early diagnosis, and prompt treatment para po maiwasan po natin yung mga complications. And kasama rin po sa extrapulmonary TB ng ating mga infants ang bakuna natin no, for BCG. So kasama rin po siya sa ang tawag dito, preventive ways po natin para ma-prevent ang TB meningitis, for example. So yun po, although yun, the question is interesting, there are many different studies po that would have interesting things to say din po about that. But for purposes, for practical purposes, we want to emphasize that it's infectious. And so our methods to prevent it are also appropriate to infectious diseases.
Ayan. So maraming salamat po, Miss Marlene and Doc Errol. So makikita po talaga natin yung kahalagahan ng 7 healthy habits upang hindi po tayo tamaan ng tuberculosis. At saka sakali mang magkakaroon ng sintomas, lagi-lagi pong sinasabi ng ating mga health experts na hindi lamang din para sa TB pero naririyan ng ating mga consultation services na hatid ng ating primary care providers. So, yung isa pong tanong po natin, no, Ms. Marlene and Doc Errol, is it possible to get reinfected immediately after recovery ng tuberculosis? Ms. Marlene and Doc Errol po to answer.
Yes, that is possible. Very interesting. And that is possible that you can get infected again after you get treated. That is if you're going to continue yung, for example, you will still continue to do your vices kung nakuha mo siya dyan, or mahina pa rin yung resistance mo and you're not taking the yung nutrition, taking care of yourself, the 7 healthy habits, you can still be infected. Plus, especially na-mention kanina dun sa presentation ni Dr. Errol, that there are risk factors that we can consider. So if the person is senior citizen, you have predisposing conditions such as diabetes or patient with HIV, diagnosis as HIV. Medyo mahina kasi yung immune system nila. So they can be infected again. So kailangan talaga natin ingatan ang sarili natin for us not to be infected again by TB. Over to you, Doc Errol.
Sorry po, I keep getting disconnected. Tama po ba the question is on whether after treatment you can still get TB?
Yes po, Doc.
I think nasagot naman na po ni Ma'am Marlene na yes, and it's a risk factor po, no? After po treatment, nagkakaroon po tayo ng scar. Parang kung nagkaroon tayo ng cavitation or ng scars in our lungs, parang after treatment, makokontrol natin yung infection. But it makes us predisposed pa rin. Parang it's also a risk factor then for infection. That's why it's important to still, yun nga po, na sabi ni Ma'am Marlene, keep doing the healthy habits and boosting our immune system to avoid infection. Yeah, yun lang po.
Ayan. So maraming salamat po, Miss Marlene and Doc Errol, no. So para po sa ating mga kababayang nagkaroon na ng TB, maaari pa rin po kayong tamaan ulit ng TB, kaya paulit-ulit pong paalala ng ating mga health expert na atin pong i-practice ang 7 healthy habits. Ayan. So para naman po sa ating next question, para po kay Doc Errol, How does the DOH plan to approach the elderly who are more prone to infection and might have hesitations in getting checked by medical experts?
Hi, thank you for that, Tina. So in our materials naman po, in our campaign design, we consider po our target audience and our most vulnerable audience din po. So that includes our elderly. And while we create materials po, one of the key things naman po outside of that is community involvement. So our target audience to see our materials, who are advocates for seniors or the elderly, they can be they are one of our partners or secondary audience para po ma-amplify natin yung message natin. So at the same time po, our partners at the regions, our centers for health development, also reach out to representative groups with whom we can partner. And these include po our local government units, our civil society organizations, our faith-based organizations po, who help us capture the wider net of audience and especially po the most vulnerable, which include our elderly.
Ayan. So maraming salamat for that, Doc Errol. And para po sa ating next question from our media partner, Mr. Rod Lagusad ng PTV. This may be answered by both Ms. Marlene and Doc Errol po, no? Kumusta ang active case finding para mabawasan ang mga nagkaka-TB po?
Actually, it is a continuous effort or strategy by the Department of Health, active case finding and intensified case finding. So just recently po, last Wednesday, we awarded those areas, LGUs as well as provincial level, we awarded them kung sino yung nakaka-reach ng mga target nila. So that's one way of recognizing their effort as well as provision of some recognition in order to achieve yung goal natin, in order to end TB.
Ayan. So maraming salamat for that, Ms. Marlene. Itatanong na rin po natin yung the rest of the questions si Mr. Rod. Napatupad na ba ang mas maikling gamutan para sa mga may TB? At kumusta ang monitoring ng program sa grassroots coordination with LGUs? Ms. Marlene po to answer.
Okay, thank you, Nikki. That's a very interesting question kasi I think it was also announced by our Honorable Secretary of Health, Secretary Herbosa, na we will be implementing a shorter treatment guidelines. Actually, there are already WHO recommendation in adopting the shorter treatment for in treating tuberculosis. Unfortunately, as of now, we're still in the finalization of the guidelines for it to be implemented. We know that prior to accepting and implementing the recommendation of the WHO and other partners, especially it's being already implemented in other countries, we have to locally adopt it in our country. So gumagawa tayo ng polisiya kung saan ito ay maipapa-implement ng sabay-sabay at pare-parehas dito sa ating Pilipinas. So we are targeting by next quarter, we will already be cascading the guidelines for them to be able to implement a shorter treatment regimen. Kasi dun sa explanation sa presentation ni Doc Errol, it take around 6 to 10 months. So sometimes yung compliance talaga ng patient natin greatly affect. So with the shorter treatment guidelines na dinidevelop natin ngayon, mas magiging maigi ang ating pagsunod ng ating mga pasyente dito. Thank you.
Ayan. So maraming salamat for that, Ms. Marlene. Doc Errol, would you like to add something po sa sinabi ni Ms. Marlene, or are you good?
None na po on my end. Thank you, Ma'am Marlene.
Ayan, thank you po, Doc Errol. So makikita po natin na talagang patuloy ang kagawaran ng kalusugan sa pag-develop ng mga strategies na mas makabubuti para sa ating mga kababayan. Ayan. So maraming salamat po Miss Marlene and Doc Errol sa pagpapaunlak sa pagsagot ng mga katanungan para sa hapon pong ito. So bago po tayo tuloy maghiwa-hiwalay sa araw na ito, muli po si Miss Marlene and Doc Errol para po sa inyong takeaway messages.
Okay, so kanina binanggit ko that in order to treat TB, it's not a DOH initiative only. Malaking hamon pa rin sa atin upang makamit natin ang isang TB-free Philippines. Hindi ito hamon para sa isang sector lamang, which is the DOH, kundi ito ay hamon para sa ating lahat upang tayo ay magtutulungan. So sama-sama nating sugpuin ang TB para sa isang healthy Pilipinas. Yes, we can end TB. Thank you.
Ayan, maraming salamat po Miss Marlene. Doc Errol for your takeaway message po.
Yes, I agree po sa sinabi ni Ma'am Marlene, and siguro parang it really just goes back then to the themes that we parang the key messages that we try to say na are parang continuing theme from last year and this year is tara't magbayanihan, TBI tuldukan. So it really emphasizes the importance of multiple sectors working together, and that includes the community po, as mentioned na rin earlier. And the global call to action is yes, we can end TB since it has already been done in other places. We are very optimistic na sa lahat po ng ating implementers from here at DOH Central up to the ground po, to the rural health unit. Those who are implementing the active case finding, intensified case finding activities, na this is parang a journey na we can make strides on ngayon na we are back, parang kumbaga after po na nag-start ng COVID-19, we are bumabalik yung notification rates natin, and so our activities then for the treatment and case finding are back para po we are on track to actually having attainable goals para sa ending TB. And lahat naman po ito din para to serve our vision of a healthy Pilipinas na siguro one day, although that day might be far, parang we are working para one day there will be a TB-free Philippines. Yun lang po. Thank you.
Ayan. So maraming salamat po Miss Marlene and Doc Errol sa napaka-short ngunit napakamalaman na discussion para sa araw na ito. No? So makikita po natin na talagang on top ang kagawaran ng kalusugan upang patuloy pa nating pababain ang cases ng tuberculosis sa ating bansa. So muli po mula noon hanggang ngayon nagpapasalamat po ang kagawaran ng kalusugan sa ating mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tamang impormasyong pangkalusugan. So muli po maraming salamat Miss Marlene and Doc Errol. Maraming salamat din po sa ating media partners at sa lahat ng tumutok sa araw na ito. At muli po ako po si Nikki Cesario, isang Juana mula sa Kagawaran ng Kalusugan, at magkita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po at sama-sama tayo sa isang healthy Pilipinas.